See important safety information about InterStim therapy at the end of the video. Only your doctor can determine if this therapy is right for you.
The central nervous system, the brain and nerves, control when and how often a person needs to urinate. In order for a person to urinate normally, the bladder muscle and the nervous system must communicate with each other through special types of nerves. When the bladder is full, one type of nerve tells the bladder to squeeze down and empty the urine. On the other hand, when the bladder is empty, this nerve is quiet so that the bladder can relax and fill up with urine. These nerves work by causing the muscles in the wall of the bladder to contract. When these muscles contract, the bladder becomes smaller and urine is emptied. A second type of nerve tells the nervous system that the bladder is filling up with urine and that it is time to urinate. A third kind of nerve tells the nervous system when the bladder is irritated by infection or other problems. Normally, these nerves are quiet because in a normal bladder, there isn't any irritation. Overactive bladder is a common problem that can cause people to have distressing symptoms, such as inability to hold urine, difficulty with emptying the bladder completely, frequent urination, or painful urination. It is believed that one possible cause of overactive bladder is that the nerves between the bladder and the nervous system are not communicating properly. The type of nerves that normally should be quiet may become turned on in many patients with overactive bladder. It is not known why this happens in some people. When these nerves are turned on, it tells the nervous system that the bladder is irritated, even though it's not, and the nervous system responds by telling the bladder muscles to contract so it can empty. This is what causes the distressing symptoms of overactive bladder, such as the urgent need to urinate, frequent urination, or losing control of urination. Therefore, it is important to understand that the cause of overactive bladder in most patients may actually be a problem with the nerves rather than a problem with the bladder itself. Doctors usually treat overactive bladder with medications. These medications help relax the muscles in the bladder. Relaxing the muscles in the bladder may reduce the symptoms of overactive bladder. While these medications may work well for some patients, they may not be effective for everyone. Furthermore, these medications can often cause unwanted side effects, like dry mouth and constipation. Overactive bladder medications mainly work on the bladder muscle. InterStim therapy works in a different way because it works on the nerves that control the bladder. There is a treatment option that doctors recommend to patients who are suffering with overactive bladder, who have not responded to or weren't able to tolerate the side effects of more conservative treatments like drugs. It is called InterStim therapy, or sacral nerve stimulation. How does InterStim therapy work? The theory is that mild stimulation of the sacral nerves reduces the signals to the nervous system, which may be causing the symptoms of overactive bladder. InterStim therapy begins with a test stimulation procedure that may be done in the office or as an outpatient procedure. During this procedure, a soft wire is placed underneath the skin near the tailbone, and then is connected to an external test stimulator that may be worn on a belt. The patient experiences the effects of sacral nerve stimulation during the at-home test period. If the patient's test stimulation results show improvement of overactive bladder symptoms, the patient may go on to have a separate procedure so that the soft wire can be connected to a neurostimulator that is implanted underneath the skin in the upper buttock. The neurostimulator is a small device that looks very similar to a heart pacemaker. It works much in the same way as a pacemaker by sending mild electrical pulses through the soft wire. In theory, these pulses stimulate the sacral nerve to control the symptoms of overactive bladder. After the procedure is completed, your doctor will turn the neurostimulator on, and that mild stimulation of the sacral nerve may assist in proper bladder function. Most patients tolerate the procedure well. Results may vary. Ask your doctor if InterStim therapy is right for you. You can also learn more at www.interstim.com.
InterStim therapy for urinary control treats urinary retention and the symptoms of overactive bladder, including urinary urge incontinence, leakage, and significant symptoms of urgency frequency. It should be considered after you have tried other treatments such as medications and behavioral therapy, and they have not worked or you could not tolerate them. Implanting an InterStim therapy system has risks similar to any surgical procedure, including swelling, bruising, bleeding, and infection. Complications associated with the InterStim therapy neurostimulation system can include pain at the implant sites, new pain, infection, lead, thin wire movement, technical or device problems, undesirable changes in urinary or bowel function, and uncomfortable stimulation, sometimes described as a jolting or shocking feeling. Any of these situations may require additional surgery or cause your symptoms to return.